Hi, everybody, and welcome to today's episode of We'll Do It live right here on Facebook. Welcome to everyone. So, let's get started. The first thing that I want to say is, before we get into today's topics, is that the newspaper that I had in mind was the Charlotte News, not the Charlotte Observer. The Charlotte Observer is the main newspaper in Charlotte, North Carolina, and I knew something was wrong about that. So what I meant was the Charlotte News. And about the Northfield News, the reason why that was on my mind was because we talked about the whole showdown with Representative Cynthia Browning, a Democrat from Bennington County, who called for quorum, and that upset the speaker, and they had this big rift in the Democratic Party. And Representative Ann Donahue, who is a Republican, wrote a really lengthy piece explaining the rules. It's very technical, but sort of the rules of what happened and what went wrong. And Representative Donahue's father was a longtime editor of the Northfield News, very storied editor, and so that's why that was on my mind. I was wondering, I was like, why am I saying these things? Okay, so now that we've got that cleared, let's move on to today's topics. Last night, Vermont Digger published my commentary titled Flattening the Curve by Spiking Health Resources, and I'm very grateful to Digger for publishing my piece. My piece was also published today by True North Reports and will soon appear on fyivt.com, so please check it out. So I thought that today we'll just go through the piece and discuss the main points. And there are some interesting comments on the piece that I would like to address. So I've talked about the Kahn laws and the regulatory labyrinth that has constrained, restricted our healthcare capacity in Vermont. And I go into this detail in my article. I will be quoting extensively from the piece. So I say basically that we are entering this war against an invisible enemy that is COVID-19 with two serious handicaps. Quote, first, Vermont administrators impose a slew of draconian regulations that have restricted the supply of health resources for years. And second, the rationing of various healthcare resources and services has been taking place for many years now under the aegis of Vermont's all-payer accountable care organization model, all-payer ACO model, that is managed by a private company called OneCare Vermont. Now here in the link right under this video, I've shared a blog post from my website, the campaign website, hansenforvermont.com, HANSEN for Vermont.com, where I share graphs and charts evidencing that the use rates of primary care physicians and specialists has gone down from 2013 to 2018. There's been a steady decline in the visits to these doctors by Vermonters. Second, the amount of diagnostic x-rays that have been prescribed has also gone down. Third, the overall healthy rate of Vermonters has also declined. Now, all of these show that these important, and one more thing, long waiting lines. Everybody knows that long waiting lines is not just anecdotal evidence anymore. There have been many articles, the latest by Burlington Free Press, explaining how Vermonters have to wait for weeks to get treatment. All of these point to the fact that the rationing of these basic healthcare resources has been taking place for years. And I explained that the reason is because they want to keep the costs down at any rate. They want to keep it down. They want to show that the model is working because the purported goal, the stated goal of this model is that it brings down healthcare costs, but it doesn't do that. So in order to somehow make it do that, they are limiting the accessibility, the availability of healthcare to Vermonters. And so this is Well, okay, so when I submitted the piece, and I believe this is true for other places as well. It's a website. Vermont Digger is a website, as are the other two publications that I mentioned, and they can publish hyperlinks, which means that if I make a statement, I can link it to the article that proves it, or some data that supports it. That way, when you're reading it, you immediately, just with a click of a link, have access to the supporting underlying data. And Vermont Digger in the past has published the hyperlinks, but this piece does not have any hyperlinks. So it seems like I'm just, speculating, but I'm not. So I made it a point to publish the supporting data on the website so it's available to everybody. And I just had an idea. I will also publish it as a post on Facebook and on Twitter so that everybody has this information. Okay, so now healthcare rationing has been taking place because of OneCare, but also because of, as I said, the draconian regulations that have been implemented, and one of them is certificate of need. So now, in theory, a certificate of need laws, or a program of such laws, aims to again bring down healthcare costs by preventing the duplication of the same services. In theory, that is the stated goal. So they don't want to have 500 hospitals and lead to excess costs. So you have to prove that there is a need for this service, get permission from the state, and then you can expand or create a new healthcare facility. However, in practice, that is not the case. In practice, as we know, because of human nature, people in power want to hold on to power. And when you have a monopoly, monopolies always want, what do they want? They want to kill competition. So when you have UVM, University of Vermont Health Network, which has a very cozy relationship with the state government, with the legislature, we have seen over and over that it's very difficult for other hospitals, and we've seen this very recently in Franklin County, not able to open a new surgical center, not able to expand healthcare resources because UVM said no. This is essentially known as a competitor's veto. There is papers after papers documenting that in practice, a competitor's veto is often issued, and this leads to artificially stopping competition, artificially limiting healthcare resources, and drying up the supply. And we have seen this happen in Vermont over and over again. Vermont has the highest number of Kahn laws in the nation. So this program was initially implemented in the 1960s, but as I said, people realized in practice it's a very restrictive law, and it leads to cronyism. And so now we only have 35 states that still enacted. Unfortunately, Vermont is one of them, but on average they have about 15 laws. We have 30. We have 30 laws. And so I've called for suspension. I don't believe that they're going to repeal it, and I don't think that's very pragmatic. However, we can suspend it. What's wrong with that? As I've said before, recently North Carolina suspended its Kahn laws, allowing healthcare providers to, add more beds in response to the COVID epidemic without getting state permission. There's no reason why we can't follow that example as well. So I talk about how regulating healthcare capacity is one of the reasons why we are at a disadvantage. We're not as prepared as we would be in facing the surge, an expected surge of COVID-19 positive cases. Another point, so I said that we have 30 Kahn laws. One of the Kahn laws prevents non-hospital settings. So let's see something like if we had a makeshift hospital come up because there's a need, because many people, let's say, contract COVID-19 and need medical attention. Well, according to the laws of the state, that place would not be able to offer medical imaging technology, which means CT scans, MRIs, X-rays. They wouldn't be able to do that. So as a result, the data has shown that there has been a lower utilization rate of these technologies in Vermont as compared to other places. Especially in rural areas, this would be very problematic. Vermont is very sparsely populated and we're a very rural state. So if it means traveling 3 hours, maybe 3.5, 4 hours back and forth just to get an x-ray, maybe people won't do that. And that's has been an inhibiting factor. It's prevented access. And so we've seen the data to showing that we have lower use rates here. On top of that, OneCare Vermont has been limiting access to that. So really, this is a serious handicap. Why? Because COVID-19, the virus, the new coronavirus, SARS-CoV-2, affects our lungs. And how do you know? You get pneumonia, you have labored breathing, you need a ventilator, you need assisted respiratory support. How do you diagnose that without medical imaging? This becomes extremely important and relevant in the pandemic, but we are at a serious disadvantage. So I say that, okay, one more thing. Because we have Kahn laws, we have 6 fewer hospitals in Vermont. And I'll get to this point because somebody in the comments made a very interesting observation, and I'll come back to that. So again, here's a quote from the article. Quote, "Fewer hospitals and ambulatory surgical centers, especially in rural areas, along with reduced access to medical imaging, will inhibit Vermont's ability to take care of all COVID-19 patients who require hospitalization and ventilators or respiratory support." Recently, North Carolina allowed hospitals to add beds without state permission. Vermont should likewise suspend its detrimental Kahn program, end quote. So when you look at our the highest Kahn burden that we have, plus this experiment, it really is an experiment. Some people who are advocates of it take issue to the using the word experiment. However, this is the first and only kind of project in the nation. No one's ever done it before. So doesn't that by definition make it an experiment? Okay, so the all-payer ACO experiment plus our very strong Kahn burden, along with other regulations, has led to a decrease in overall healthcare openness and access. So the Mercatus Center, which by the way is not a conservative think tank, the Mercatus Center issued a report in 2020, and they rate 51 jurisdictions, so 50 states and Washington, D.C., based on overall healthcare openness and access. And where do we rank? Vermont ranks 43rd in overall healthcare openness and access. That's not good news when we are faced with an unprecedented in living memory pandemic. Now, specifically, we are 45th for imposing operational constraints on hospitals, payers, and pharmacies. By payers, they mean Medicare, Medicaid, VA, and commercial insurance. People who pay, so paying, that's what their definition is. For the amount of constraints, the amount of restrictions and regulations that we impose on all these groups, thanks to the all-payer model, we rank 45th in the nation. Okay, then we rank 47th because of our draconian regulations on health insurance. Anybody who lives in Vermont knows about the annual double-digit increase in health insurance premiums that we are all subjected to. We know that we have, so the average you look at a 40-year-old non-smoker, and when you look at the average plan, we know that it's one of the highest in the nation, even though there are about 500,000 adults here in Vermont. We already know that. This is our lived experience, firsthand experience. We know that the health insurance system here is very broken. So as a result of that, we're 47th in the nation. And this is what I mean by the regulatory labyrinth, this maze that constricts and restricts and imposes limitations on every aspect of our healthcare capacity, our ability to access healthcare resources and services that are essential, even more so in the midst of a pandemic. And then I talked about rationing, as I explained. I'm going to share the article on Facebook as well, so it's easily accessible. So the idea is, you know that single payer is a pet project of a particular faction of our politicians. When Governor Shumlin came to office in 2011, this was one of his main objectives, to implement single payer in Vermont. But it failed. It failed because they did honest number crunching. And here's something that I really want you to understand. Why did single payer fail? It failed because the rate of growth, annual growth, they say, okay, let's implement the model. What happens? The growth every year was far more than the annual GDP of Vermont. So there just isn't enough money. It would cost so much money. Never mind the rationing, never mind all of that. Just in terms of logistics, the model broke, because you can't have something that costs more than the amount of monies that are available every year. So that's why when in September 2016, so just before, was it? Yes, September 2016. Was it? Yeah, just before the Obama administration was done. The state of Vermont, when it got into an agreement with the federal government to try this new experiment, all-payer ACO model, which if I just want to put it very crudely, it's single payer 2.0. So it's the same groups, the healthcare authorities, the Green Mountain Care Board, the Department of Healthcare Access of Vermont, the same healthcare administrators that we have are now need to show that the reason why single payer broke doesn't happen again with this model. So it's very important to keep the costs down, keep it down year after year, and show, hey, look, it is bringing down costs and the model isn't breaking. But the only way that they can do that, is by preventing Vermonters from accessing healthcare services. This is why we have seen reduced visits to primary care physicians, reduced visits to specialists, reduced diagnostic x-rays, long waiting lines. This is why. They want to save the model. They want to serve ideology over individuals. And so this is what I write here. This austerity, as I call it here, comes at the cost of Vermonters' health. So we've also seen worsening healthcare quality indicators. Now, one argument is, oh, maybe everything is going down, because everyone's healthier. As I said earlier, the overall healthy rates of Vermonters across the state has gone down. Healthcare quality indicators, when you look at specific parameters to measure the overall health of Vermonters, it's been going down, it's been declining. So there's no improvement that's happening here, which is why that argument doesn't stand. And so I say that we are confronting this invisible enemy at a serious disadvantage, and the only way forward is by increasing the state's healthcare capacity. This calls for stopping the healthcare rationing that's going on and by suspending the Kahn Program. But this requires political will to let go of regulations, which means let go of power and let go of ideological experiments and pet projects. That is equal to demanding the impossible, but we are in an incredible time. No one could have ever imagined national shutdown, global shutdown. So I just hope that by writing these commentaries, by putting out the facts, I, 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 I want it to be of service to Vermonters, but I also hope that it could serve as guidance to those in power. Now, having said that, if you see, one of my topics for today is politics as usual, continuing, even though, even as we watch the world completely turn upside down before our very eyes, politics continues as usual, which, to be honest, is a lesson for me. I didn't expect that at all. I'm genuinely surprised by the continued partisanship that I'm experiencing. So on that note, let's get to the comments. I think that will illustrate what I mean by the continued partisanship. So now some of you might know, and for those of you who don't, Dartmouth College is my alma mater. I went there for graduate school, and that's also where I met Rick, who is now my husband. So I have a great love for Dartmouth College. The motto of Dartmouth, it's in Latin, but it translates to a voice crying out in the wilderness. Yeah. So the reason why I bring it up is because sometimes I feel that my voice and others like John McLaury, who is the founder of the Ethan Allen Institute, he is an economics expert, and no one can ever accuse him of not knowing what he's talking about. So people like John McLaury, the president of Ethan Allen Institute, Rob Roper, myself, people who write about policies but are not a part of the supermajority politically, we are like voices crying out in the wilderness. I feel like that sometimes. Okay, so the first comment is by Dr. Myers, who I know, and he's a very respected physician, and he says, I agree with many points made by Dr. Hansen that she raises in her thoughtful commentary. However, I disagree with her statement that Vermont needs up to 6 hospitals. Indeed, it is hard to make that case when many of the hospitals are on the verge of closing. We do need to give smaller hospitals more support. Now, that's a very good comment, and that's what I talked about, that if we didn't have the Kahn program, we could have had 6 more hospitals. I'm not saying that we need 6 more hospitals. I'm not saying that. That's not, I think maybe that was sort of not clear. I'm not saying that we definitely need it. I'm saying that in the face of a pandemic, we would definitely be better off having more than less. And I completely agree with giving full support to the hospitals that we do have. But then this again ties into the all-payer model and how that model is trying to reshape and remake the healthcare landscape in Vermont. And if I have a moment, I'll get to that very briefly, and I'll explain how that model is basically imposing constraints. As I said, we're 47th in the nation for the amount of constraints that we impose as a state. We impose on hospitals, and that has led to a lot of them closing, like Springfield Hospital, for example. So I would say that it ties into the whole healthcare rationing and the fact that the all-payer model is fundamentally flawed, and it needs to end, along with the regulations like the Kahn program. Okay. The second comment also agrees with me. He talks about monopolies and how centralized control have failed to serve the needs of recipients, and instead they serve the needs of the institution. As I said, serving ideology and pet projects over individuals. Okay, so and then let me get to the detractors. So let me get to that. Okay, great. This is what I said. This is from Mr. Bob Zell, I think that's how, I'm not sure how to pronounce his last name. He says, quote, "This commentary is from the world of upside down, even for a Republican." And so that's what I meant by partisanship continuing on. in this strange time. I did not write this piece as a Republican. My healthcare experience, my understanding of health policy, and the reasons why I'm writing and doing this has nothing to do with politics, has nothing to do with republicanism or conservatism. So just approaching what I've written from that bias point of view, I think then will distort everything that I'm writing, and unfortunately make this individual arrive at wrong conclusions. So he defends Kahn, and he says that the Kahn program was put into place to so that competing hospitals would not buy expensive, duplicate, redundant equipment, and this would that would drive up hospital costs and make healthcare unaffordable even in a rural state. How soon we forget! Exclamation. As I said, in theory, in the 60s, it was implemented with this idea, but we're not in the 60s anymore. And 50 years on, people have seen that in practice, it is in essence a competitor's veto. It helps politically powerful monopolies to hold on to their centralized power. It kills competition, and it artificially limits health resources, which, by the way, drives up healthcare costs. Tomorrow I'll give you the exact statistics, but the Mercatus study actually even says how much, by how many dollars is the cost of healthcare higher in Vermont because of Kahn laws. So it is counterproductive. It has an opposite effect of what it says it will. So unfortunately, Mr. Zell is wrong, but I think this commentary, I mean, I could be wrong, I can't read his mind, but it seems to me, because he said even for a Republican, it seems to me that this is about how do we protect the status quo and present a contrarian view to the facts that I've written about in this commentary. And then I don't know, I'm just going to quickly read this. From the realm of the Luddites, I guess he's calling me a Luddite, I don't know. We don't need any shared medical database. So doctors, nurses have access. Okay, it doesn't make any sense. So let's not waste time on that. But I think it was just about trying to say that I'm a Luddite, but which is okay. That's his point of view. He does want to know, he asks facts, please. He does want to know how OneCare is rationing. So I can only hope that he sees the link where I present charts and data that actually I got from the Vermont Department of Health Access and OneCare itself. Okay, and then I hope it doesn't get cut off. I see the time is 6:27. Last time at 6:30 it got cut off. If it does, I'll come back. So, okay, now Mr. John Greenberg says, before Ms. Hansen blames the COVID-19 pandemic on Vermont's healthcare decisions prior to January. I'm not blaming the pandemic on Vermont's healthcare decisions prior to January. Okay, that's not what I'm saying. I'm saying that we are not best prepared, and we are experiencing shortages, and Governor Phil Scott and others are looking to shut down our economy at great cost, mind you. We have, I believe, 40,000 unemployment claims that have come in. We're doing this at great cost because our state is not in a position to manage the expected surge of coronavirus patients. That's why I'm saying we're not prepared, which is why I'm presenting easy solutions by which we can increase our state's healthcare capacity. So I don't know this idea. Then there's something about Trump. The Trump administration did nothing but repeatedly lie to the public. Okay, so I'm sorry, but he's lost me there. this has nothing to do with the president or any other politician. I'm just looking at Vermont and how we can be ready for this crisis, and I'm just giving solutions that we can implement today. Okay. All right. And then then there's the final comment is by Mr. Dan Decotu. I'm sorry if I'm mispronouncing it. And he says that the priorities of the legislature are elsewhere. They've been toward, in his words, a Green New Deal, chasing climate change, or other priorities. And so we're now in this difficult situation. I think that sort of ties into protecting ideology and serving ideology over individuals. And also the lack of accountability, no accountability whatsoever. So I believe these are, if you'll see, these are recurring patterns. It'll come up again. It comes up in education. It comes up in energy and electricity. It's obviously pervasive in the realm of healthcare. So I agree with that. All right, well, that's it for today. I'll be back here again tomorrow at 6 p.m. Please send in your questions. You can leave it here in the comments or an email at info@hansenforvermont.com. See you tomorrow.